Esophageal dilation is a particular procedure that is typically done during the upper endoscopy. It is reserved for patients with specific esophageal conditions where patients develop esophageal strictures. Now, what are strictures? Typically, strictures are caused by scar tissue formation within the esophagus. There's a variety ranging from anywhere from caustic injury, that is accidental or otherwise ingestion of alkali dyes or chemical solvents or anything like that. It's rare, but it happens. Chronic gastroesophageal reflux disease that will cause fibrous tissue formation within the esophagus due to frequent bathing of the esophagus in natural stomach acid. Basically, any condition that will cause either an acute or chronic injury to the esophagus, any part of the esophagus, by the way, can and will induce scar tissue formation within the esophagus. And over time, that scar tissue is going to grow, and it will continuously grow until such time when it starts impeding with normal esophageal function. To allow food and drinks, liquids, to go down uninhibitedly from the mouth into the stomach. So whenever patients develop sufficiently large enough for fibrous tissues, then patients will start feeling as if something is getting stuck in their chest. And this is typically the time at which we employ the upper endoscopy first to identify the problem, and then thereafter there's a variety of tools that we use to open up those strictures, to rectify the problem that the patients develop. More frequently nowadays, and probably the safest ways of doing dilation, is esophageal balloon dilatations. Now, what are those? We employ a sausage-like device that is passed under the direct visualization of an upper endoscope into the esophagus, and then we dilate that tool, typically with either saline or air, and by slowly dilating that sausage-like tool, it slowly starts stretching the scar tissue until it rips it. And once that ripping effect took place, that's when we know esophageal patency has been restored. The food and liquids will start flowing into the stomach unimpededly, and problem solved.